Thanks very much. I think I can work without the mic. Okay, thank you to everybody, and yes, it's really quite amazing to see nearly 300 people in the room, and actually more people live streaming as well. So I want to thank everybody for coming. As Darren has indicated, I'm actually looking to try and actually break down the regulations into sort of meaningful things for you to take away. And actually see how can I use them and what do they actually mean, for me on a day-to-day basis. So I just want to get this right. Forward. So the first thing is, of course, the health research regulations are not actually called the health research regulations. They're called the wonderfully titled Data Protection Act 2018, Section 36(2), Health Research Regulations 2018, which is a bit of a mouthful for just about anybody, and I won't actually be using it again. But I do say it to people just in case you actually want to look up on a website the formal regulations on the statute books in Ireland. You know, if you Google this title, it'll take you into the more formal ones. If you actually Google health research regulations, more likely going to take you into the guidance on the HRB, which actually has links to all of these things anyway for you. But it is just important to actually note that that is its full title. And the reason I actually bring this up also is because actually the title is in some way a bit instructive. I have to go this way, I think. Yeah, so first and foremost, I'm going to have a look and tell you that actually it is not a standalone piece of legislation. It's operating within a context. And in reality, it's operating within, first and foremost, the overarching regulation, which is the General Data Protection Regulation. And in that, you know that regulation came into force in Ireland on the 25th of May and came in as a direct effect. So it didn't actually require any legislation within Ireland in order to take effect. However, it does have certain aspects of it that give member states the entitlement to go and implement in specific ways that are sort of unique to itself. So in Ireland, we introduced the Data Protection Act 2018 in order to introduce these within and to give these effect in Ireland. And then in that, we then have the health research regulations, which give specific effect to research activities in Ireland in the area of the health domain specifically. So those are the three pieces of legislation that are acting. If I go on again. So this is very detailed, but I'm only going to bring you to one section, which I've actually got a typo in. Section 32, so it actually be Section 36. And the reason I actually mention this at all is I just want to say that what the health research regulation is actually introducing has not come out of just anywhere. Section 32 in the Data Protection Act actually identifies all the suitable and specific measures that are actually articulated in the health research regulation. And those didn't come out of nowhere either. They actually come from Article 89 in GDPR. So again, it's just to say to you, the health research regulations didn't introduce anything new. They're actually putting in one place all that you actually need to know when you want to do data processing in the context of health research. So it's kind of actually meant to be an aid to you, really, so that instead of having to refer to GDPR, the Data Protection Act, and the health research regulations, you can actually take the health research regulations as being a sort of a kind of a composite of all of those. Now should move? Yes, sorry. There you go. So I know that Murish has gone through some of this already with you. What do the actual health research regulations do? Can I go back one slide? Yeah. So I've tried to break down the regulations into sort of sections of where they have purpose. So the first and most important thing they do is they identify the mandatory, suitable and specific measures that are required for personal data, for processing of personal data for the purposes of health research. And that's in Regulation 3.1. And you can actually look it up and you'll actually see them all listed down there for you. The second is it produces a definition of health research. Now, I'll talk about this a little bit more going forward. It's really a definition of health research. It's not a definition of research. So it outlines the scope of the health research activities that are actually covered by the regulation. And that's in Regulation 3.2. It also introduces, as Mirish and others have said, the first time a legal process for obtaining a declaration that consent is not required for research. So this is the first time this has been in a legal sense. And then it also allows for transitional arrangements for ongoing research. And finally, it actually gives a legislative force for the establishment of the committee that is actually going to look at those consent declarations. It's got a variety of other little measures, but we don't really need to deal with them today. So I'm going to talk a little bit about what are the suitable and specific measures. So these are actually, as I say, they're actually written out in actually very plain English within the regulation itself. So there are 5 of them. So the first is that it actually must be necessary that the data that you collect and the processing that you're doing, it must be limited to what is necessary to achieve the objectives of your research. And it must not cause damage or distress to the person or the people whose data you're using. So that's really very important. So what is limited to what is necessary, that's actually sort of data minimization. It's a key principle under GDPR. You should only collect what you require in order to achieve your aims. The second is that it introduces a range of appropriate governance structures. These are really good information governance principles. So they're not new. They're really an awful lot of what you should be doing as a matter of course. So, for example, by definition, you need ethical approval. You need to know who are the data controllers. Do you have more than one data controller? Who's doing what under those circumstances? Do you have data processors? And again, who's doing what, when, and who's responsible for things? You need to have a clear delineation of responsibilities. You also need to be able to identify who is providing the funding for the research. Again, these should all be questions that you know and can answer in your own right. And most importantly, you need to know who you're going to share your data with. There is actually a mandatory requirement to provide data protection training to those people who are actually doing processing. So that might include actually data protection training, say, for example, to students who are actually working on projects, or postdocs, or other people within your team, as well as maybe yourself. Thirdly, the regulations require processes and procedures and systems to be in place. And these are very much to ensure that you have compliance with GDPR, compliance with the data minimization principle that is a key tenet. You must be able to do an assessment in the first instance of what are the data protection risks that you might be running with the data processing that you're doing. And if they're high, and none of us here can answer when that is the case, but you should actually look at this yourself and also in consultation with your data protection officer to know when do you think the risks are actually really running quite high. And under those circumstances, you have to do a formal data privacy impact assessment. That's the DPIA for people, you'll hear that term. In addition, you must have control procedures to log who's accessing and processing data, and also to prevent unauthorized access. So that's really important. And you must have other security measures in place as well to make sure that if there are any things that happen, or a computer gets lost, or data gets misplaced or something, that actually it's protected, it's encrypted, it's password encoded, and so on. And then really essentially any other technical or organizational measures that you feel are appropriate to ensure that you're actually compliant with GDPR. And you also need to have an end of project plan. What are you going to do with the data when you no longer require it? Are you going to simply store it or archive it? Are you going to anonymize it? Or are you going to delete it? So these are things you need to consider at the start of a project, not simply when you arrive at the end and wonder, what am I going to do now? You also need to, I suppose, look at transparency. Now, I actually think rather than a suitable and specific measure, this is actually a tool that you can use yourself really to actually help you be compliant. Because transparency, when you inform, you get informed patient consent, when you ensure that the patients, that there are no surprises to what you're going to be doing. In fact, you're really ensuring that you're GDPR compliant. So transparency is actually, for me, it's almost like a real safeguard to you, not even as well as the patient and the people whose data you're using. And finally, the regulations make explicit consent the default the mandatory default position that you must comply with. So explicit consent of those people whose data that you are using. So why are they mandatory? Why do we feel so strongly about this? Well, really, first and foremost, this is all about ensuring patient and public trust and confidence and support of research activities. For us, it's vital that patients and the public do not react and say, what are you doing with our data? We don't trust you with our data. We have to have trust. And these regulations are actually to ensure that, to protect that trust. They're nothing more, I think, than anybody would say than good governance procedures. Best practice, I hope, but nonetheless, long established best practice governance of information. They do bring, and it has been mentioned by Mirish before, certainty, consistency, and clarity to the data protection rules. And as I mentioned, it actually puts them in one place. So for us, we feel that that's actually vital to running a really good and innovative health research, I suppose. Now, again, I'm not going to go through all this. This is, in fact, the definition of health research straight out of the regulations. So I really only put it up there to show you it does exist. And if I move on a little, I'll summarize it. You can see that it is very encompassing. It includes experimental and translational and clinical research, public health research, social care research, population health research. In fact, really any research that has a health dimension, effectively. So that's, it covers everything. In addition, and we think this is very important and it's very specific in the regulations, it includes actions that are taken to establish whether a patient or another individual is actually a suitable candidate to be included in the research. So that's really important. So it's actually a preliminary processing step. And everybody says, we have a definition of health research, but as I've indicated, that is much more to do with the scope of the health aspect of research rather than a definition of research itself. We do not provide a definition of research. In reality, it's difficult for us on the outside to define what research is versus service evaluation, clinical audit, or in fact what is normal practice. So we really feel that you're in a much better position to define it. What I would say to you is, if you think it's going to be research at the outset, because very, very often it may have two purposes. Thank you, I'm a bit hoarse. So very often it has two purposes. If one of them is research, then the regulations apply, even if it's a dual purpose. So if you are doing clinical audit, and at the start it's a clinical audit, and you've no other expectations other than that, the regulations do not apply. But if you morph it into research down the way, because suddenly you think, oh, this is very interesting, I think I should publish this, then in reality, it is research. You should think about this at the start for preference rather than in the middle. But if you discover it in the middle, then you need to take action, and actually take action to be GDPR and regulatory compliance at that time. So I think that's the important thing about that. So I'm moving on to consent. Again, this is all very much definitions that are within GDPR. So what is consent? In GDPR terms, it must be unbundled. So it must be separate from other terms and conditions. It must be freely given, and we've had a lot of conversation about informed consent and when it is freely given. But the most important thing is that it must be a genuine choice. So consent that might be given under pressure is not valid consent. That's really important if a doctor is involved and somebody feels under pressure over their treatment. So you need to really make sure that people understand that their treatment is never going to be compromised regardless of what they consent. It must be active. So no automatic opt-in. You have to actually make an active choice to opt in. You can't have pre-ticked boxes. So this is one of the things that's very commonly occurs. It is not a sort of an opt-out issue. It must be granular. And we've discussed that a little bit before. So granular, very specific. So in real terms, you're looking to try and get people so that they know precisely what they are consenting to. Mirish has alluded to or has spoken about the fact that, of course, in research that can be difficult to achieve. And we recognise that actually questions might arise that you didn't predict in the first instance. And we recognise that. So the regulations do very genuinely allow for that to take place. So it's within more broad areas that you can actually get consent. We recommend that there is a sort of a tiered approach and that people can actually opt into the specific, slightly more general again, and so on. And that they can actually make active decisions to say, well, actually, look, beyond this, I don't give my consent anymore. So that would be one good way of doing it. And the other thing is that, yes, blanket consent that is open-ended, no circumscribing it within a research area at all is just simply no longer valid. And you can see, I tried to just mention a little here about explicit consent. In fact, explicit consent is nothing more than an express statement of consent, really. There should be just no ambiguity about the fact that a person or a patient has consented to the use of their data. So otherwise, in every other sense, it is the same as consent, regular consent under GDPR. Did I mention it must be easy to withdraw and document it? So I didn't quite go through everything in there, but it is actually just very important that you to do all those things as well. So consent, we've mentioned before, it's not terribly different to what consent was required previously. Here, if you look, I've put up what the definition of consent is under GDPR, and the terms are freely given, specific, informed, unambiguous intention of the data subject's wishes, right? So you see all these words. Data Protection Directive has freely given, specific, informed, unambiguous. So there is no difference in a large sense to what the consent should be. I've identified a couple of things that you may have fallen foul with in the past. First of all, as I said, opt-out tick boxes are not valid anymore. Presumed or implied consent is absolutely no longer valid if you have it. It must, blanket consent doesn't qualify anymore, and many cases people are not necessarily told how to withdraw their consent, and that is actually a requirement under GDPR now. So those are a couple of the things that you need to actually assess when you're looking at your current consent to see if actually you are covered and are GDPR compliant. So one other thing just to say about consent. So under GDPR, consent is obviously a legal basis. Yeah, you probably have come across some of these terms before. Equally, explicit consent, when you're actually processing a special category of data, so health data falls in under the special category of data, you actually also need to meet a GDPR Article 9 condition. And you know that actually processing data for obviously healthcare is one of those conditions, and also processing data for the purposes of health research is another one. So you may actually be able to, in theory, do health research without ever seeking consent in the context of a GDPR sense. And I think Mirish was mentioning that in the UK, for example, they don't recommend that you have consent as your legal basis. That is obviously a choice for you, and you have to look at your specific circumstances as to whether this is appropriate or not. But in the end of the day, the health research regulations make explicit consent mandatory unless you happen to have a consent declaration. And as we know, consent declarations are given in exceptional circumstances. So essentially, this is just something to be aware of. You can have a legal basis and an Article 9 condition that do not involve consent, or indeed you might, but irrespective of that, you must have explicit consent because of the health research regulations anyway. So it's like the health research regulations trump it in terms of their requirement. So we've mentioned the word consent declaration, and I know everybody here is really madly keen to know more about it. So It is, in fact, a declaration that the explicit consent of the data subject or the person whose information you have is not required for the data processing. And as mentioned, it's exceptional circumstances only, really. So I have, when might a consent declaration apply? So essentially, if you are new research, so you've not commenced yet, really the standards that you must, or the criteria that you must meet, is that the research is of sufficient public importance that it outweighs significantly the public interest in requiring the explicit consent of the individual involved. And why is that important? It's important because this is actually a fundamental right of the individuals whose data you're using. So it's not simply that anybody thinks that your research may not be of public importance. It actually has to be of public importance to outweigh the fundamental right of the individual to privacy. So this is the sort of thought process that you need to have in your head when you're actually thinking about these. And then, as mentioned, in terms of the current research, that is obviously one option, again, if you have research that's underway and it is obviously of public interest and sufficient to outweigh I suppose, public interest of requiring the explicit consent of the individual. And then alternatively, there is a second option in this instance, and that is where you have consent under the previous directive. It is compliant with the previous directive, but it is not fully compliant with GDPR requirements. So you can apply for a consent declaration then also. So this has been said before. This is not a get out of jail clause at all. It is not designed to whitewash or brush over previous practices that really weren't up to scratch. And I don't need to say too much more about the research ethics committees. We recognise that consent waivers were given in good faith, but unfortunately, in the context of GDPR and the health research regulations, they're not valid. This is just a technical point. Just when is research current and when is it new? This is outlined in the regulation specifically. So essentially, health research is current when on or before the 7th of August, that's the date before the regulations came into effect, the research was approved by a research ethics committee. And essentially, the date line that you're looking at is the date on the letter of your research ethics approval letter. That's the date that you will use as your reference point. And clearly, obviously, it's new if it's beyond that. You can say it is new. And it's no longer a 9-month period of transition. That is clear. It has now moved on to, the key date that you need to know in terms of the transitional arrangements is the 30th of April 2019. So we all know the clock is ticking, and I know everybody is aware of that as well. So who makes the consent declaration? Again, this is outlined in the regulations. There's a committee of persons mentioned in the regulations. I think that's going to be known as the Health Research Consent Declaration Committee in the long run. There will be about 15 to 21 members on the committee. There will be a chairman, 2 vice chairmen, essentially, or chairpersons on the committee, and that will allow actually perhaps for the committees to actually sit, multiple versions of the committees to sit at the same time to help process applications. So it really is actually for efficiency as much as anything else. It is meant to be comprised of all of the sort of really relevant stakeholders. Clearly, data subjects and people whose data will be processed, they're lay people, their views are important and will be part of it. People who are part of the healthcare system and researchers as well. So it is actually going to have quite a wide range of skills and capabilities, and people who can see, a multitude of different viewpoints. And be out there also to see it from the data subject's point of view as well as the researchers. Now, you don't need to read all this, I promise. But I know people are concerned about, I need to apply, what do I need to do to apply, when am I going to find out when I can apply? So clearly, I can't answer that question yet, because that's obviously in the hands of the Department of Health and so on. But I would like to say to you that actually, what is required for an application is already outlined in the research regulations. And there is a huge amount of work that you can be doing right this minute in order to get ready for it. So for new research, Regulation 5 is the key regulation, and it tells you exactly what you need to have in order to actually, fulfill your application. So you need to be able to identify. I have to say, most of this information you actually will have in your head. So what is the GDPR lawful basis that you're operating under? And what is the Article 9.2 condition? You should know this information. You need to know who the data controllers are. Is it it's your organization? Do you have joint data controllers? You might have partners. Are they data controllers in the context of what GDPR means? You need to know this. If you don't know these answers to these questions, you must talk to your DPO and try and work these things out. So they will assist you in actually trying to work it out. It's sort of not rocket science. You'll be able to do it, really. You need to be able to tell why you can't use anonymized data, for example. That's a good exercise on people's part. Do you really need to have personal data, or can you do it with anonymized data? If you can, do. Because you don't have to worry about GDPR if you can get out of having personal data. So we recommend that you do that if you can. Again, things like, are you, ensuring that there's no damage or distress to individuals? I hope so, on most people's part. Looking at the data minimization. Do I have the least amount of data? Is there data here that I'm just collecting for the sake of it, or whatever? These are all questions that you can answer. They're in the regulations. They must be part of an application because they are required information in order for the committee to actually make their assessment. So you can see all of this. The key one is really at the end. You need a statement to say, how come you believe, and have you any evidence to back it up, that the public interest in carrying out research significantly outweighs the public interest in the privacy of the individual? That's the judgment call. That's the call that the committee is going to have to make. The rest of it is actually ensuring you've got good governance involved already. And if I go on to the existing research, you'll find 90% of it is the same, and the only thing is different is whether you need a statement explaining the public interest of your work, or alternatively, whether or not, if you have previous GDPR consent, what have you done to try and re-consent people, and how come you haven't been able to consent some and you need to actually seek a consent declaration as well. So those basically are the two, the extra bits that you need for current research. And you can actually be doing all of this like right now. You don't need anybody else's information in order to actually do that. So I'm not really going to go through this too much. Essentially, it's just to let you know the committee can obviously give consent declarations. It can obviously refuse them. It can put criteria or conditions on giving a consent declaration. It can revoke them. So I think that's an important thing. The reality is, if you get a consent declaration, it's not a consent declaration for life. You will most likely need to justify, possibly on an annual, or I'm not quite sure what the committee will decide in the end, why you continue to need that consent declaration. So that's not that you have to reapply every single year, that's not what I mean, but it is that you will need to continue to justify your need for it. And when you don't need the consent declaration anymore, you must have an end-of-life plan in order to anonymize or delete or in some way archive the material safely. So those are things you need to consider. And it's been mentioned before, you can appeal the committee decisions, and that will be to another independent committee. All right, I really need to move along. Okay, again, I'm not going to talk too much about the Secretariat. That's really being established by the Health Research Board. The committee is going to sit within the Health Research Board, but it's actually the committee itself, or the Secretariat is going to sit within the Health Research Board, but the committee is actually reporting to the Minister. So it's not going to be reporting into anybody within the Health Research Board. It is not the Health Research Board's committee. It is merely being serviced as a committee by them and by some of their staff. So that's being established as we speak, and it is expected that as soon as they get up and running, they will obviously be putting formal application forms together and putting out guidance in how to complete those applications. But as I say, all of those applications must have the information that I've mentioned before. They can't, they may require a little bit extra information, but that's the core. I think Darren mentioned that the HRB has a decision tree up on its guidance. We're suggesting you have a look at that. That is not actually a decision tree about information governance principles. It's actually to see, am I and should I consider applying to a consent declaration committee in the first instance? Because this is not actually meant to be a port of first call, it should be a port of last resort actually to you. So go and have a look at that. Again, it identifies things that you must have done in advance of any application going forward. Remember that when the Secretariat is established, the Secretariat is going to make sure that only fully complete applications that have all the required information are going to go forward to a committee for consideration. If they're not and they don't have the information, they're only going to go back to you and say, please do it. So you need to have a look at the decision tree. That will assist you actually in making sure that your application form is actually quite complete. And I'm nearly done. So actions for researchers, even in the absence of having a committee in place as we speak. And essentially it is, please do read the guidance that's on the HRB's website. It is useful. It tells you a lot of practical information. It gives you a lot of definitions. It answers a lot of frequently answered questions. I recommend you do a data protection impact assessment, and in most cases you're going to need a formal data protection, or sometimes they're known as data privacy impact assessment. So do that. Do it in consultation with your data protection officer. Consider if you can anonymize your data. That's obviously a really important first step. If you can, do. And where necessary, and in most instances for research that is ongoing currently, try and get re-consent. It is actually a requirement of the application into the consent committee that you have demonstrated that you have tried to re-consent people in compliance with GDPR, and you must have very good reasons if you cannot do that at all. So maybe that you can do it partially, but you can't do it completely. So these are things you need to have tried to do. And that's it. This is the key to guidance for researchers that's on the website. And I hope that you'll find it of use. And I hope you'll find the talk of use as well. Thank you.